Hello, everyone. My name is Dan Hermrich. I'm the Director of Certification and Accreditation for NADSP, the National Alliance for Direct Support Professionals. I'm here with my colleague, John Raphael, our Director of Educational Services.
Hello, everybody. How you doing?
And we're here to talk about the role that the NADSP competencies can play in this strange time we're living in when we're quarantined and isolating because of this COVID-19 coronavirus. This started out as a blog post on the NADSP website. So if you'd like to review that, it's available to you. But we thought we'd just sort of have a discussion around some of the ideas that were in that blog post. So before we get started, John, I think we should probably talk about, this strange time we're living in.
Mm.
You and I, before all this hit, had the privilege of going around and talking to DSPs all over the country.
Mhm.
And one of the things we would talk to them about are these competencies, are these skills that DSPs, when you think about it, use every single day,
Mhm.
use in their work every single day, often without realizing that they're using skills, that they really are a highly skilled professional. Um, so I think what we want to do here is talk about how those same skills that DSPs already use might also be very helpful during this COVID-19 pandemic. Now, that does not mean that we're saying that, hey, this is no big deal, that, the skills are the skills, that, nothing has changed.
Mm.
Um, the skills are going to be used in a very different way right
Right.
now. But we want DSPs to know that they have the skills they need to deal with some of these challenges.
Right. I'm thinking, yeah, I think that's so important. You think uh, like a nurse, yeah, or a physician. Obviously, we're thinking a lot about those professionals these days. They're focused on certain parts of the things that they have been trained and educated in, probably more so than other things that they've been trained in. I'm just thinking like the issues in and around the respiratory system.
Sure.
That's something that I think doctors and nurses, they certainly know about, but they're really having to focus on that part of what they've been taught. Doesn't mean that they're not going to be looking at other aspects of a person's, health, whether that is, their kidneys or whatever else that might be something that they've been trained in or competent in assessing. Um, but I think it's a very strange time in some ways for direct support professionals, um, because there is such a focus on health and
Right.
on obviously keeping people, disease free and virus free. So
Yeah.
yeah, I think that's a good beginning. I think
Yeah.
that's
So it's
yeah.
certainly a scarier time. There are certainly risks in doing direct support work right now that weren't necessarily present before.
Yeah.
But the skills tend to be pretty universal. I mean, they're the same whether you're working as a DSP in Maine or Hawaii. Um, and
Yep.
they're also the same skills we're going to draw on during this time as we would draw on, before the pandemic.
And I think in some ways, and we're going to see this through this presentation, is that I think this is it's a golden opportunity in some ways for honing some of these skills that, ironically enough, uh, we might have not had an opportunity to before all this
Right.
stuff came into
Right.
play.
Right, so this diagram actually comes from the President's Committee on People with Intellectual Disabilities report from 2017. That report is really focused on the direct support workforce, and this graphic comes from that report to the President of the United States. Uh, and I think it illustrates an important truth about direct support, that direct support professionals have a very diverse set of skills. They have to be very, very versatile, very, very flexible in their work. Um, we've had this discussion that's come up lately with the pandemic about, are direct support professionals healthcare workers? And I guess my answer to that would be, they're not only healthcare workers. Certainly, a lot of their skills overlap with the skills that are expected of certain healthcare professionals. But DSPs also have all these other expectations, all these other skills they need to draw on outside of the healthcare world, such as their teaching skills, such as the ability to maybe drive a 15-passenger van. As wonderful as nurses are, we don't often expect that of a nurse. Um, so just wanted to start off with this idea that the DSP skill set is a very amazing, diverse set of skills. That DSPs are these amazing people that can do all these different things with a great deal of skill.
Yeah, yeah. And the reality is the pressure's on now. It is because there is going to be a focus on a lot of the stuff that is health related. But man, these other things aren't going away. I mean, that's you do have to. You're still going to be driving people around. You're still going to be refereeing certain situations if you're working with groups of people that are in crisis, and we'll talk about those things. So.
And John, since you're the New Yorker on this webinar, I'll let you talk about this slide.
Yeah, this is a quote that is pretty powerful. Clarence Sundrum is the gentleman you see there pictured in that photograph, and he's a civil rights lawyer. He's worked obviously in New York State, but really throughout the country, throughout the world, in terms of helping people with disabilities claim their civil rights. He he's a huge player in the closure of the Willowbrook State Institution in New York State. But in his report that he wrote essentially to the governor of New York State after some scandal here in New York State with the service provision to people with developmental disabilities getting abused and so forth, he wrote a report. You can actually find it on our website. It's the Measure of Society is the name of the report, and it's a basically an overview of of why people with disabilities, why are they abused, why are they neglected, why are they vulnerable. It's a very interesting report. But what he did in this report, he talked about the workforce. He talked about direct support professionals, and this quote we have used for years. And it's a very interesting quote because one might summarize the job description of the direct support worker as requiring the wisdom of Solomon, the patience of Job, and the caring of Florence Nightingale. And in the light of this pandemic, and in the light of what we have been seeing the last now going on 2 months with direct support workers throughout North America, they are absolutely doing all these things. And when this pandemic is over, we are hoping that we can use the evidence of how impactful and how important direct support professionals are, so that we can not only give them more recognition and be proud, um, but ultimately look at policy changes and wage changes so that direct support professionals aren't, you know you're not some angel, you are a professional. And that quote really is a great quote. So um,
Yeah,
Clarence, I'm good.
thank you, that's wonderful. I want to talk a little bit about the different competency sets that are out there. What you see in front of you here is the CMS core competency areas, the Centers for Medicare and Medicaid Services core competency areas. These are the competencies that have been released by CMS, by the federal government in the United States. And these are the basis of NADSP's eBadge Academy. They tend to be a little more generic because they're written for a broader audience. They're written for any sort of direct support worker in any type of human services. So these are out there. I wanted people to be aware of them. They're not what we're going to focus on today, though. Today, we're going to focus on the NADSP competency areas. They've been around a little longer, and they're much more focused on DSPs that are working with people with intellectual and developmental disabilities. So there are 15 NADSP competencies. We're not going to go over all 15 on this webinar. We're going to pick a few here and there that we think are especially important right now. But there are 15 of them. If you're not familiar with them, we'd encourage you to go on to the nadsp.org and download a copy of them. All right, John. So let's start with the big one. Let's start with supporting health and wellness, which is really right at the top of the page right now for DSPs. There's a focus on supporting people's health and wellness during this pandemic.
Yeah, it seems obvious, but I think when we look at the different statements, I think it can help direct support professionals understand really how important their role is.
Yeah, so that second bullet point there, preventing illness and accidents, I think is especially important right now. And certainly, we want to avoid exposure to the coronavirus. We want to be, washing our hands and engaging in social distancing. But I'd say avoiding accidents is pretty important right now too. I mean, this is not a great time to go to the emergency room.
Exactly. Yeah, I'm thinking, specifically falls. I'm thinking things even like cuts, where it might lead into something that would need a look at, maybe in an emergency room or whatever. But you're right, Dan. I know a local hospital here. I have a friend that's a nurse, and it is pretty much locked down. It's very hard to get into it.
Right.
And you just want to try to avoid having to get some kind of medical procedure not involved with COVID.
Right.
And we do know
certainly, if people need to go to the ER, they need to go to the ER. But boy, if you
Sure.
can keep them out of that situation by making sure that accident doesn't happen,
Yeah.
so much the better.
Yeah, without a doubt. And it's a time, I think, to look at adaptive equipment, to make sure your adaptive equipment is all up and running. Make sure walkers and whether gate belts are all in good operating shape, whatever it might be.
And I think this is true for DSPs as well, right? All those safe lifting procedures and transfer procedures that you've been trained on. Maybe it's been a while, but you've been trained on them. I mean, this is not a good time for a DSP to experience a muscle strain or a back injury.
Yep. Or need stitches because they were cutting the vegetables a little too rigorously, and they chopped their end of their index finger off. Try not to do that.
John, that last bullet point, scheduling, keeping, and following through on all health appointments. A lot of those routine, doctor's visits, annual physicals, things like that, those are getting rescheduled right now. And, or maybe sometimes they're going to some sort of online telemedicine sort of situation.
Sure.
And so DSPs are going to have to stay on top of that, help people to stay on top of that.
That's right.
Personal care and hygiene certainly is of an added importance right now. DSPs are going to be helping people with good hand washing techniques to keep themselves and others as safe as possible. The adaptive equipment, as you already mentioned, I think is really important right now, especially when people have adaptive equipment that might be related to respiratory issues or other chronic health conditions they might have.
Absolutely. A lot of people that, especially older folks that maybe lived in institutions, respiratory issues are abundant, whether it's COPD, chronic obstructive pulmonary disorder, or things where they're doing some kind of respiratory maintenance or respiratory therapy. This is a very important time to make sure and work with your medical team, if you have a medical team, or your nurse or whomever, where if there is a respiratory regimen and therapy that's done, make sure it's done. Make sure inhalers are available, because this virus, we do know enough that it does attack the respiratory system, and it's a respiratory disease. And man, I know people that are smokers that have stopped smoking because of the fear of what's going to happen if they should contract this virus. So very important.
Yeah, and I think with those chronic health conditions, even things like hypertension, high blood pressure,
Yep.
we know put people at greater risk.
Yep.
And so the things that are in place to help people manage those sorts of chronic conditions take on a special importance right now.
Yep. And who is there most of the time assisting with this is the direct support professionals in
Absolutely.
organizations. Yep.
Community living skills and supports. These tend to be the skills that DSPs use when they're working in someone's home. And a lot of people are spending a lot more time at home right now with direct support professionals in some cases. A lot of DSPs that used to work in day settings, employment related supports, may find themselves now suddenly supporting people in their home.
Yep.
So this, I think, is an important set of skills right now.
Absolutely.
So again, we're helping people to maintain their bodies, to maintain their physical health, and certainly hygiene plays a role in that. And then this idea of household management, right? The stuff you do to maintain your household. When you're spending more time at home, I don't know about you, John, but all of a sudden there's all these little tasks around the house that
That's right.
you suddenly have time to work on now. And for people that are receiving supports, maybe there are skills related to household management that they suddenly have a lot more time to develop with the help of DSPs.
Yes. And think about this, Dan. I know before the days of being quarantined and having to shelter in place or whatever it's being called, oftentimes direct support professionals who worked in particularly congregate settings like group home kind of settings and stuff like that, they're very busy because there is a mandate often for people to get out and about, to be beyond
Right.
what they need to do at home, to go to wherever it is, that day program or their job, or visit friends or go do things. Now that we're cooped up literally, um, that can be a time, and this is the ironic thing, right? We can maybe do a little bit more in terms of teaching people how to cook, and how to do better organization of their closets, and to hey, this is a perfect time to maybe look at the bathroom. How can we make the bathroom nicer for us? I mean, whatever it might be. I mean, there's a million things you can do that we now do have time to do. Um, and this is the caution, and I think we've seen this on our Facebook page. I think I know it through hearing anecdotes from people all around the country. We can fall into the trap of being kind of like, uh, uh, what's the word I'm after?
Yeah, I mean, there's a danger when you're
D-
coming, especially for DSPs that maybe have worked in other settings. There's a real danger to come into someone's home and try to take charge.
yeah, that's what. Yeah, 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 yeah. Oh, it's time. Oh, it's lasagna night. Okay, that's nice. Maybe if everybody wants lasagna, or if the person you're supporting wants to have lasagna, but if you want to have lasagna, that's very nice. But let's make sure we ask and make sure we're person centered. Remember that, person centered.
Yeah.
Oh, that could
And
be tricky. It could be
and I
tricky,
think
right?
that's going to be a theme throughout these competencies, John,
Yeah.
is that these decisions about what are we going to do today, what are we going to do tomorrow, what's the plan,
Hmm.
those decisions really need to be made in partnership with the people that you're supporting.
That's the
um,
word. Yep.
And DSPs might be tasked with um, researching the options, coming up with some ideas, but you're always bringing those options, you're always bringing those ideas to the people you support.
Yeah.
Would you like to do this? Would you like to learn to do the laundry today?
Yep.
Would you like to, learn to make lasagna? Do you want to have lasagna tonight? Do you want to
Yeah.
do a jigsaw puzzle, or maybe is that something that you don't feel like doing right now?
Exactly.
When we're all kind of, as you said, cooped up together, it takes on an added importance that we're listening to the people we support, and
Yeah.
we're involving them in all of these decisions.
And I think one other thing, and then we can move on because we could spend the whole webinar on this. If we are supporting people on a more individual basis, maybe we see them 3 times a week at a supported apartment or something like that. There's also a danger that we are dictating that person's kind of life, and it can happen. It's not intentional. It's not done for any ill intention, put it that way. But we just got to keep reminding ourselves that we got to take the lead of the person that we're supporting. And oftentimes, people that are in individual situations, people with developmental and intellectual disabilities that we support who are living on their own often can fall victim to a lot of loneliness. And now, even more so, it can be very easy for us to go into those independent situations and kind of dictate what's going on. And we got to be careful with that.
Absolutely, absolutely. Some other stuff in this competency that we're going to talk about in other places. That development of friendships and relationships is an important part of community living. There's also a whole nother competency that focuses on that. So we'll talk about that in a few minutes. But I want to touch on this last bullet point, that DSPs are helping people to, it says here, recruit and train service providers as needed. I think that training piece could be especially important right now because, John, I think we're likely to see new people coming into the human services system that maybe don't have a whole lot of experience working with people with disabilities.
Yep, golden opportunity for us that have been doing this work for a long time. When you have these brand new direct support professionals coming in who don't know what our work is, who don't know what our profession's about, this is your opportunity to shine and to show them and to keep in mind all the things that are evident in being a person-centered direct support professional, that we take the lead from the people we support, that we're in partnership with them. We're not necessarily nurses. We're not healthcare workers, quote unquote. There's so much more to what we do. And for somebody that doesn't know what we do in these times when, there's personal protective equipment needs and lots of focus on health, that can be easily mistaken by a brand new direct support professional who doesn't understand all those other things that we started off the webinar with. That you are multi skilled, and there's multi competencies, and this is your moment to make sure those new people get that.
And some of those new people might just be looking for some kind of short-term job.
Yeah.
But there's always the potential that people will discover this work and fall in love with it. We want to welcome those people.
Yep.
We don't want them to feel unwelcome.
Exactly.
All right. Communication is one of those 15 competency areas that I think is really important right now. People are going to be communicating with us. People are going to be letting us know when they're bored, when they're afraid, when they're maybe not feeling well. And in some cases, with some of the people you support, that communication might be really straightforward and really easily understood. They might just literally walk up and tell you, I'm afraid, I'm bored, I'm frustrated, I don't feel well. But for a lot of people, that communication is going to be a little more subtle. that it'll be coming through their use of their facial expressions, through their use of behavior. And it takes a skilled and knowledgeable direct support professional to not overlook or misunderstand some of those forms of communication.
Yeah. And I think one referring right back to what we just talked about like maybe new staff and a new direct support professional coming in, if you're working with somebody brand new, that's where you can help with helping them understand communication and what that means for the people you support.
Yeah, because if you've worked with someone for a period of time, again, you might not even realize how skilled you are at communicating with them, how skilled you are at understanding their communication. Um, I think that last bullet point on this slide about terminology and explaining terminology, we are getting flooded with all sorts of new vocabulary right now. If you're watching the news, you're getting all these new terms, coronavirus and COVID-19 and social distancing and, stay at home. And DSPs are going to find themselves in the role of sort of being a translator, um, explaining what this stuff means in plain language to the people they support. And that's a really crucial role right now. And we do have some resources on the NADSP website that can
Yeah.
help with that.
Yeah, so I was just gonna say it's under the COVID-19 resources for direct support professionals for DSPs. And you can tons of stuff, really good stuff.
All right, assessment. This kind of overlaps a little bit with communication, I think. There's not a whole lot of difference between someone communicating through their behavior that something might be wrong, and a DSP observing these changes in behavior and assessing that something might be wrong. And this competency talks about both formal and informal assessment practices. I think for DSPs, that informal assessment has always been a strength. DSPs that have any length of service become highly skilled at informal assessment, and it may not even realize that they are very skilled in informal assessment. Um,
Yeah. I think Dan, I think when we get to the next bullets here, that there's some things that subtle things. The person, their eyes don't look right. Your bowel movements are at a different time of day. These are things that DSPs know and that they need to help other people know. And this time, more than probably any time, these subtle little changes can mean a lot to the possible diagnosis of COVID-19.
Yeah, John, you and I did another webinar on this competency, and there
Hmm.
was a phrase we use that I think is really important and really illustrates how DSPs use informal assessment. It's something's not quite right.
Yeah, yeah. There you go. There you go. And to trust that gut, because it is a gut. It is informal. That doesn't mean it should be discounted. Um, and I think the very important thing is that a DSP needs to ring that bell when they're feeling as though something's not quite right. And maybe they didn't do it, maybe it is even more formal that, okay, a person's, their temperature is elevated, it's
Right.
elevated, it's going up a degree in the last 3 or 4 hours. That's time to ring the bell, call other people in, as based on your assessment, and whether you're wrong or right, it's your responsibility to make that call.
Right. And I mean, DSPs are not going to be the ones, making a diagnosis that, someone has COVID-19.
Exactly.
But those other professionals that are responsible for that probably are never going to get involved without that DSP having that initial informal assessment
Yep.
and documenting it and reporting it and communicating it so that those other professionals can come into play.
It's interesting, Dan. Our medical advisor and Dr. Rick Reeder, he's going to be doing another webinar on an update on the COVID-19 situation and what that means for direct support professionals. He has stated time and again, and will continue to state, that he relies on the assessment skills of direct support professionals for his diagnosis. When it comes to the elements that need to be kind of put together to determine if somebody is ill with this disease.
Yeah, yeah. So it's a crucial role. And again, DSPs, they're doing this, right? But it's just a matter of understanding that when DSPs are doing this, they are using a professional skill.
Mm-hmm.
Community and service networking. We have this phrase we use in our trainings that direct support professionals' office is the community. That's where DSPs do their work, is in the community. And that office, that community is changing right now, and it's changing on a daily basis in some cases. There are resources, there are activities in the community that people may have been using that are no longer available to them. There may be things that are available in a different sort of way. There are all these businesses and agencies and organizations that are trying to find ways to adapt, trying to find ways to provide products and services in this new reality that we're facing.
Mm-hmm. Mm-hmm.
As a direct support professional, you need to kind of be on top of what's going on in your community. John, if someone were providing support to me, it would probably be a good idea for them to know that the coffee shop I go to on 17th Street is closed, but there's another location on 29th Street where the drive-through is open. So there's still a mechanism for me to get my coffee.
Yeah.
That's still that option available. And
Yeah.
all sorts of things are changing right now, and DSPs need to understand that and know what options are available to the people they support.
Yep. And I think what's going to happen, and this is all the, you hear it on the news, and you can tell our lives are going to change now. All of our lives in our communities. For instance, I think we're going to see more and more, whether it's a grocery store or wherever, curbside delivery, curbside pickup. Now, that doesn't mean that, you as the direct support professional, you're going to be going to fetch the goodies from the grocery store. It means, that's, instead of going to the grocery store shopping with the people you're supporting and teaching them the elements of shopping and using coupons and whatever else, well, no, you're going to be teaching people and showing people what curbside pickup means. And because our world is going to probably likely drastically change, and our community is going to look different. It doesn't mean we're going to protect people from these changes. We're going to introduce people to these changes, and that's a very important thing for us to continue to monitor in ourselves as direct support professionals.
Absolutely. All right, let's talk about facilitation of services. That idea that we've already talked about planning in partnership with the people you're supporting. That's all over this competency, and I do think that's especially important right now. The language here on the screen is participatory planning techniques, and really what that means is what you said earlier, John, kind of following the lead of the person you're supporting. Involving them in the planning process, whether you're planning your day, whether you're planning some sort of long-term goal, not imposing those plans as a professional, but discussing options and looking into the things that are available and making those decisions in partnership with the people you're supporting.
And I think this is what I think what happens when we're in a situation like we're in now, when what we see and what we know, these are with news articles that we've been seeing from all around, excuse me, all around the country. Excuse me. Direct support professionals are being relied on, not just for all the things we've been talking about this whole session, but the actual implementation of things in the lives of the people supported. And for instance, individual support plan meetings, whatever they're called in your region, when there is the need for an annual review of a person's goals and all that business. Now is a time, probably more than ever, that direct support professionals are going to be kind of, they're at the forefront of doing this stuff, and hopefully, doing it alongside and with partnership and with the people they support in a very person-centered way. But it there's a lot of administrator type people and more clinical people that might be distanced, literally socially distanced from the people supported based on the requirements in a locality, or what a policy of an organization is saying right now about quarantining. So this is a skill. It's not that easy to help somebody run an ISP meeting or whatever. So uh, we can't underestimate this particular competency.
Absolutely. Um, and those meetings are probably going to be happening in some sort of virtual way now. Um, and so DSPs might be in charge of helping people to, log into a Zoom meeting or a, GoTo meeting, and to participate virtually in their own support plan meetings. And that obviously is going um, to be a different way of approaching those meetings.
Exactly. All right.
Building and maintaining friendships and relationships. All of us as human beings are social creatures. We need interaction with other people. It's hardwired into us.
Yep.
And so DSPs are expected to help the people that they support, to build relationships, to maintain existing relationships. And that's going to look a little different right now, but it certainly is no less important. How are you helping people to stay in contact with people that are important to them, whether that's family members, whether that's friends, whether that's romantic partners? How can you as a DSP help them to maintain those relationships? And certainly, I think technology is going to play a role here, just as it does with the planning meetings. Those video platforms can help you to set up meetings, to set up virtual dinners, virtual talks with people that are important to the people you support.
Yeah. Um, I think we're going to get to it. Well, I'm going to bring it up now. Um, we have been, I've been seeing a lot about this, that people with intellectual and developmental disability specifically, um, especially older people that lived in institutions, perhaps, that we're supporting now, um, they're kind of experts at isolation,
Yeah.
and they have had lives of isolation. And one of the major components of what we do is to help the world understand that people with intellectual developmental disabilities, um, they are part of our world. They are equal community members and citizens as we are. But obviously, we're still dealing with 40 years ago. We locked people away. So one of the main elements in terms of a competency for direct support professionals is in, and frankly, this is I think one of the most important of the competencies. And in this time, the muscles that I think a lot of the people we support already have go towards isolation, and there might need to be a little bit more prompting to get people to push them a little bit to not be isolated, and by virtue of the technology we just talked about and so forth. So I think it's very important that we don't, again, don't underestimate this important competency at this time.
Yeah, yeah. It's not something we can just, put on the back burner until all of this is over.
Mhm.
We as human beings need to make those connections, and people we support are going to need our help in finding ways to reach out, to interact, to communicate with people who are important to them.
Yeah.
All right, John, this is our last competency of the day,
All right.
crisis prevention and intervention. So much of what we've already talked about could be put under the umbrella of crisis prevention. If you're communicating with people, if you're listening to people, if you're assessing for those little subtle changes in behavior, if
Mhm.
you're involving people in the planning process and giving them some control over their lives during this time when a lot of us might feel like we don't have much control. These are all things that are going to prevent a potential crisis. Um, but this is a stressful time, and there could be moments when all those stresses kind of boil over and people do go into a crisis. And DSPs will need to use their knowledge of the person to intervene and to help people to get back to a place of feeling safe and secure.
Yeah. And, and I think, Dan, one thing which is critical, um, at this time, I think all of us are experiencing anxiety. We're experiencing uncertainty. We might be experiencing depression. We might be angry. Just you as a direct support professional, you gotta check yourself. And where are you at?
Right.
Especially again, if you're cooped up and you're spending extra shifts and extra hours with people, make sure that you're checking yourself so that you can be there for another person. And if you're unable to do that, you gotta call out. You gotta call somebody. You can't.
Yeah.
The crisis, and what we do know, sometimes abuse and even neglect can happen inadvertently without necessarily intention. And at this time when we are all on edge, it can interfere with our moments in a crisis situation when we're supporting somebody who's in their own crisis. If we're not able to address that, we've got to get help. We've got to get help. You've got to talk to a supervisor, talk to somebody. Very important.
Yeah, absolutely. Um, so that's the competencies we kind of identified as being crucial right now. We do want to take a little bit of time here at the end and just mention who we are. We are the National Alliance for Direct Support Professionals. We are a membership-based organization. We are finding that during this pandemic, there are a lot of people that are discovering us for the first time, that are discovering some of our resources for the first time. If that's you, we would love to have you as a member of NADSP. You can certainly find out more on our website. Another thing that we would like is to hear from you about what's going on in your world during this pandemic. We want to capture your stories. And one of the ways we'd like to do that is through these videos. The website there at the bottom of the page is a website where you can upload a video of yourself kind of describing what you're dealing with right now as a DSP. The good and the bad, the wonderful happy stories of some amazing thing that happened, but also, the challenges that you're facing. We want to use these stories in advocacy efforts down the road when the immediate emergency is over. We want to help policymakers and really the general public understand just how essential you are as a direct support professional. We think the stories are going to be crucial in helping people to see that.
Yeah, absolutely.
All right. Well, that's what we had for you today. Thank you so much, John, for joining me on this webinar.
Thanks, Dan. It was an important one to do, and uh, I appreciate your time, and we appreciate everything that direct support professionals are doing. And don't hesitate to reach out to us.
Yeah, and stay well, stay safe, wash your hands, all of those things you know about. But yes, thank you to DSPs all over the country that are working during this pandemic.
Stay tuned.